we are going to talk about the body dysmorphic disorder, shortly called BDD. So, obsessive preoccupation with the perceived defect in one physical appearance. So, body dysmorphic disorder, a mental illness we characterized by obsessive focus on an perceived flaw in appearance. Obsessive preoccupation with perceived defect on physical appearance. So, particularly, the risk factor, particularly age like adolescence or peer bullying, it is most common in the school, neglect, abuse, mental health disorder. So there are signs and symptoms like expressed concern about a perceived physical flaw or constant worried about what others think, attempting to hide a perceived flaw like extra makeup, clothing, or perfectionist trait. So how we diagnose it? So your provider may recommend one or more of these diagnostic tests and procedure as part of an evaluation. And the doctor basically performs a psychological evaluation and follow the standard guideline to make a diagnosis. So this said preoccupation with appearance severely impaired social, occupational, and academic functionings. Also rule out the other mental health disorder like anorexia, delusional disorder, or any kind of hallucination or illusion. So what are the treatment options? So the major treatment is CBT, means cognitive behavioral therapy. So CBT is appropriate care for distorted body image is a significant steps to recovery. And cognitive behavioral therapy, an approach where the irritational thoughts are recognized, analyzed, and also restructured to the more rational self-talk is frequently used in planning care to address the body image disturbance. Also, nursing assessment, nursing intervention, or recommended the resources is important. And if the cognitive behavioral therapy is not enough, we go for medication, particularly SSRI, serotonin, selective serotonin reuptake inhibitor, or SNRI, selective non-like receptor inhibitors. So also the nursing care, patient for substance abuse, we have to evaluate, or any kind of suicidal ideations. So the preoccupation with an imagined or exaggerated defect in their physical appearance. So if you give a good counseling, it can help. So it is actually somatoform disorder, and somatoform intervention is important, like client education, medication, or lifestyle change, way to cope with anxiety and stress, relaxation technique is helpful, or physical activity, get them busy. Basically, the treatment goal, the client will express the feelings verbally rather than thought physical symptom. Let me talk about the gender dysphoria. This is the conflict between a person's experienced or expressed the gender and the one they are assigned at birth. So gender dysphoria is a condition where a person is experiencing the discomfort or distress because there is a mismatch between their biological sex and gender identity. And it is sometimes known as the gender identity disorder and also gender in congenital or transgender problem. So basically, if patients have gender dysphoria, it is important to identify or interdisciplinary approach, and also important to clinical management. And as a healthcare provider, we go for early life experience, gender development, experience and feelings, sexual development, and sexuality, relationship, education, everything need to evaluate. So first of all, risk factor, biological factors like congenital adrenal hyperplasia. This is the one of the genetic defect. Usually, the baby who born with congenital adrenal dysplasia, they have a chance to develop gender dysphoria because it is very difficult to distinguish between man and female. Also, psychosocial factors. The sign symptom, a strong desire to be the perceived as their experience the gender or dislike of one's existence, sexual anatomy, rejection of trait typically associated with their assigned gender. So next, go here. The diagnosis, the presence of symptom more than 6 months. And also, it is important, we have to talk with the patient, like talk therapy, motivate, counseling, and gender confirmations surgeries if patient want or need. And sometimes hormonal therapy work as well. So what are the nursing care? So we refer the patient by their preferred name and pronouns, and also need to evaluate patients for depression, anxiety, substance abuse, or suicidal ideations. And dysphonia is a profound state of unerased or dissatisfactions, and it is the the difficult to distinguish their sexual satisfactions particularly. So the major nursing care plan goal for sexual dysfunction, gender dysphoria, or paraphilias are the client will resume the sexual activity at the level of satisfactory to self and partner. And the client will express the satisfactions with own sexual pattern. So conductive disorder, shortly called CD, this is the spectrum of disorder characterized by repetitive aggressive behavior that is violates the right of others. Also, oppositional defect disorder, right? So conductive disorder, particularly a behavioral or emotional disorder that present as a repetitive, disruptive, and violent behavior that is usually occurred during the childhood and adolescence. So basically, we find out this or diagnose the disease according to the sign and symptom. The patient is very aggressiveness, like bullying other children, or they violate, they do not follow any rules and regulations in the school. And symptoms can be mild, such as they like to lie, or moderate, such as the stealing, or also severe, such a rape. So the risk factor, psychiatric disorder, like ADHD, depression, bipolar disorder. Sex, it is more common in the man, and also dysfunctional family environment can lead to develop conductive disorder. Learning disorder, sign symptom, aggressive, and also they're very rude to the people or animals, or destruction of the property or the thrift. So as I told you, very beginning, the symptom can be mild, such as uh, tell a lie, or moderate, such as stealing something, thief, or severe, such as sexual assault or rape. The treatment, the anger management training, or talk therapy or counseling, medication to the treat psychiatric comorbidities, if any. So it is important before to treatment, go for the diagnosis, like evaluate is done by the mental healthcare profession, and for one to have the conduct disorder. And they must have at least 3 repetitive behavior which impair the child's social life greatly, and at least one behavior should last for more than 6 months. And treatment, we told already explained a little bit, but the therapy is very effective, like behavioral therapy or talk therapy. Behavioral therapy to help the child to control the behavior, and talk therapy done to identify and treat the mental problem and also causing the symptom. Sometimes self-care is very effective. Always talk to your provider before starting anything. It is always good. And next go nursing care, set clear boundaries, and limitation is important. So nursing intervention for the client with conduct disorder basically include decrease the violence and increase the compliance with treatment. The nurse must set limit, right, also on unacceptable behavior at this. Improving the coping skill and self-esteem. The nurse must show acceptance of client as a worthwhile persons, or promote the social interaction. Very important. And also, it is important to share with you, it is good to work to establish the trusting relationship with the child who have conductive disorder. We provide the behavioral guidelines, talk to the client about making acceptable choice, and so educate the child effective problem-solving skill and help him identify the personal needs, also the best strategies for meeting them. So, what are the consistent discipline is important? Also, reward positive for positive behaviors. So, factitious disorder, exaggerating or inducing physical or psychiatric symptom to gain attention. Also, it is known as the Munchausen syndrome. So, factitious disorder, a disorder in which someone is pretend to be sick by health or by the health injuries or making themselves sick because to get the attention, right? And the risk factor measure childhood illness, childhood abuse, personality disorder. What are the sign symptoms? Extensive medical history, inconsistency in symptoms and information provided by patients. BS, exam findings and medical records. So when examiner examine them, nothing can found. When provide for physical or laboratory work, blood work, nothing can see. And symptom of factitious disorder include exaggerations of symptom or also very dramatic presentations, also presence of symptom only while being observed, also long medical record of multiple admission to the different hospital, also having the vast knowledge of disease and one claim to have also many surgical scar. So they said diagnosis evidence on deceptive behavior like falsifications of symptom, induction of injury, behavior or attributable to other medical health disorder. So the physician may suspect the disorder when the symptoms and lab tests are contraindicatory. So symptom and lab result are not same. It is contradictory. And the person's medical history does not add up, or when the person claims not to heal after standard therapy. And the patient is then referred to a mental health professional, right? And also much more likely to the healthcare professionals. So what are the treatment options? Like talk therapy and treatment for comorbidity psychiatric conditions. So the goal is to prevent the further unnecessary medical intervention. In case of factitious disorder imposed on another, the primary aim is to prevent the potential harm to the victims. Medication can be used to treat associated condition, and therapy is the main treatment. So if you ask me, what are the medication basically we use? We prescribe antidepressant to treat the associated depression like sertraline or citalopram.